Good afternoon. I'm Muriel Bowser. We are in the John A. Wilson building in downtown Washington, D.C. I'm joined by members of my public health and public safety teams. We are here to discuss two issues that we will use a public emergency to address. And the public emergency will allow us to expedite and streamline our responses to both. Those issues are opioid overdoses, and the second issue is youth violence. So I want to be clear, they're two distinct issues, but today I will declare public emergencies to allow the government's response, especially to procuring services, to be expedited. We spoke about opioid and substance abuse a few weeks ago, just 2 weeks ago actually, when we opened the Stabilization Center in downtown Washington. And since the center opened to patients on the 31st, the team has already provided care to more than 105 people, many being connected to long-term support. So I want to acknowledge and declare this emergency, not suggesting that the work to curb opioid overdoses isn't already happening, but in some cases to speed up that work, the procurement of services. I want to also acknowledge that the commission that is helping us devise more actions related to overdoses will be commenting on some dollars, and Dr. Bazran could say more about that, which we may or soon will have access to. Still, we have too many people dying in our city related to fentanyl overdoses, most specifically. The emergency will also require enhanced data sharing regarding fatal and non-fatal overdoses, and this will allow us to gain a more complete picture of overdoses as they occur. Interim Director Creighton will share more about this part of the public emergency. The second part of the public emergency relates to youth violence. We know that we have too many young people involved in violent activity in our city, both causing violence and becoming victims of violence. And it's going to take a sustained response from our entire community, the government, MPD, schools, the criminal justice system, including the courts and supervision agencies, faith communities, and families. And while we understand that we're not going to arrest our way out of this violence, we also know that young people need to have consequences and boundaries. When young people are involved in violent crime, when they're 12, 13, 14, that means that those children need serious intervention. In just the last 5 weeks, 5 young people have been killed while under electronic monitoring. Those young people were being monitored by the Superior Court's Social Services Division. This number alone tells us that we have to provide more intervention for kids that are in trouble. And to that end, this public emergency will allow us to increase capacity more quickly and efficiently across the continuum of placements for kids that are ordered by judges into care. But again, I need to emphasize how much the community needs to come together on this issue of young people involved in crime. We need parents and caregivers to make sure they know where their teenagers are and what they're doing. If you need help with your children, you need to reach out to someone, starting with their school, that can connect you to appropriate interventions. If your child or family has a case manager because you're involved in another of our programs, you can reach out to that case manager. You can also call 211, which is a family services helpline, and tell them you need help. But it's too dangerous for our kids in our cities to go unchecked or unsupervised or unparented. So to share more details, I'm going to ask the Deputy Mayor to say a few to say a little bit more, and then we will hear from Interim Deputy Mayor Creighton.
Thank you, Mayor Bowser. Good afternoon. I'm Lindsay Appiah. I'm the Deputy Mayor for Public Safety and Justice. Since Mayor Bowser first took office in 2015, we've consistently asked ourselves, what does love look like in public policy when it comes to protecting our children? The answer to that question has taken many forms and has guided many of our decisions related to the policies and programs we've put in place to help our kids thrive. We're fortunate that so many of the young people in our city are flourishing, but we believe that we are only ever doing as well as our most vulnerable children. And unfortunately, those are often our youth who are engaged in the riskiest behavior. As adults, we have the responsibility to keep our young people safe. The existence of our juvenile justice system is an acknowledgement of the inherent difference in young people when compared with adults. And we have to consider how to safeguard and provide for their mental, emotional, and physical needs of those youth, including those charged with the most serious crimes. That certainly includes creating and enforcing necessary boundaries. That is loving. And that means ensuring at a basic level that they have the right level of services and supports, including the right level of placement. With the introduction of the Safer, Stronger Amendment Act this summer, Mayor Bowser proposed restoring the ability of the court to consider whether youth charged with a crime of violence or dangerous crime are themselves at significant risk of harm such that detention is appropriate. We don't want our young people in secure detention. And we're working to find ways in a challenging system to identify and provide rehabilitative services and supports to more at-use risk youth over whom the executive has no nexus. But we can't fail to act on what our current reality is, in which our youth are being shot and killed. We can't fail to provide them with the services they need, because if they're not alive, we can't help them. And no group is at risk of harm greater than those engaged in the most risky and dangerous criminal activity. Between January and October of this year, 97 youth have been shot, including 15 fatally. And we have to do everything we can to ensure that our youth live. And that includes giving courts the ability to consider risks, mitigating against their safety and the safety of the public. Today's order from Mayor Bowser addresses how we can respond urgently to our youth's needs by ensuring there's a wide continuum of placement options for our young people that are engaged in the juvenile justice system. While shelter homes, which are community-based group homes, are one piece of that continuum, we know our youth have a host of needs, and we're invested in meeting those rehabilitative needs while providing for the safety of the public by having a wide range of placements. While we don't want any of our youth involved in the juvenile justice system, we want them to be in DYRS custody when they are, because we know whether pretrial or committed, they're safer and have better outcomes. We recognize when it comes to our young people, we have to work together. Whether it's improving public safety, enhancing the administration of justice, or creating systems of care for crime victims, youth, and their families in the district, we all have a collective desire to see our youth excel, to see our families thrive, and see communities in all 8 wards be and feel safe. Thanks.
Good afternoon, everyone, and thank you to Mayor Bowser for calling this important gathering regarding the opioid epidemic today. My name is Kiana Creighton, and I have the pleasure of serving as Interim Deputy Mayor for Health and Human Services for the district. I'd also like to acknowledge City Administrator Donahue, as well as several of our agency directors, Dr. Bazran, Melissa Bird, and Dr. Bennett, as well as our other colleagues. For the first time in a century, and that's worth repeating, for the first time in a century, the U.S. is experiencing a decrease in life expectancy, and opioid overdoses are a driving cause of that. Sadly, D.C. is not immune to the issue. As the mayor said, the opioid epidemic is not new, but it is an ever-changing situation which requires us to continually go back to the drawing board and determine if the tools we are using are addressing the issue in the most effective way possible. There's no one-size-fits-all solution for this epidemic. In December 2018, Mayor Bowser released Live Long DC, the district's strategic plan to reduce opioid use, misuse, and related deaths. The plan involves local, public, and private partners working together to find comprehensive solutions with a focus on prevention, harm reduction, treatment, and recovery. Together, we've laid the foundation for a person-centered system of care at the community level. A multifaceted issue, such as the opioid epidemic in DC, warrants a multifaceted response that is rooted and shaped by evidence-based practices. We know substance use disorder is a chronic, relapsing disease, and so our response elevates prevention while also meeting people where they are in their journeys. The public emergency on opioids will allow us to continue to think about ways that we are coming together, particularly focusing on enhancing our data sharing to expedite the public health response. Next, the public health emergency calls on my colleagues at the Department of Behavioral Health, DC Health, the Chief Medical Examiner, and Fire and Medical Services to input overdoses and suspected non-fatal overdoses into a common data tracking system. Having a common data tracking system will give us a better picture of the opioid use and the effects in the district. As the mayor mentioned, we can then deploy outreach teams to those hotspots and offer harm reduction services and support. The goal is to keep people alive. While there's a lot of variance with the opioid epidemic, here's what we do know. Harm reduction saves lives. In addition to the Stabilization Center, the Department of Behavioral Health has deployed numerous harm reduction responses that have helped save lives across the district. Harm reduction is an evidence-based approach to working with people who use drugs to keep them alive and as healthy as possible while we hope to engage them to seek treatment. Harm reduction also engages family, friends, and the community to be a part of our overdose prevention strategy. Naloxone is a key part of our response. Naloxone reversed over 5,000 suspected overdoses in 2022 alone. Naloxone is widely available in our community, including at pharmacies and DC public schools and 7 harm reduction vending machines throughout the city. Be ready, because in instances where naloxone can help, it can only help if you have it. We know that there is strength in community. We are so fortunate to partner with a robust network of organizations. Whether it's finding housing with Oxford House or getting care from Unity Healthcare or Mary Center or peer specialists at the DC Injury Center, they all lead with compassion and person-centered care. In 2022, 35% of people who died from an opioid overdose had a history of treatment. Treatment and maintaining treatment matters. Just last month, we opened the city's first stabilization center. The DC Stabilization Center is a safe place for people who are struggling with substance use disorder to get immediate help that they need. In the first 2 weeks, as just a few minutes ago we were told, we actually have seen 139 residents receive care already at the Stabilization Center. We've also certified treatment providers available in every ward from 33 community-based providers. But we know we still have a lot of work to do. And while I recognize the travesty and severity of the issue, I also have hope in the inherent assets that exist in many of our communities, especially among those who are active recovery themselves, who have taken their experience to lend support by offering their peer support to others who are struggling with opioid use disorder. 2 weeks ago at the Stabilization Center, many of us met Mr. Eric Scott. Mr. Scott is now 10 years in recovery after over 20 years in the cycles of addiction, and he is a part of the DBH community response team. He constantly provides empathetic care and support to all individuals managing substance use challenges, and many of our solutions we know exist within our community. And so we are here today to ask our DC community, our neighbors, family, and friends to be a part of the solution. We know that stigma can sometimes keep people out of treatment. We ask you to look out for one another and to lend help without judgment. Everyone living with addiction deserves a fair shot at recovery. We are on a mission to provide an evidence-informed, thoughtful, and dignified response to this epidemic. We have to continue to focus on what works while also searching and advancing new proven solutions as well. I want to thank Mayor Bowser, my colleagues across city government, and our broader community as we continue to work for innovative solutions. Thank you.
Thank you. Thank you. Thank you for that, Deputy Mayor Creighton. And let me as well acknowledge everyone who is here. The City Administrator, Kevin Donahue, the Chief of our Fire Department, Chief John Donnelly, Director Barbara Bazron, the Director of the Department of Behavioral Health, Director Sam Abbott, the Director of DYRS, Dr. Ayana Bennett, the Director of DC Health, Melissa Bird, the Assistant Director at DHCF, Dr. Robert Holman, the Fire and Emergency Medical Services, our Medical Director, as well as Clint Osborne, the Interim Director for HCMA. So with that, we'll take any questions. Sam.
Mayor, a number of us were at court this morning when the issue came up as to whether the judge would hold the city in tent over issues around housing girls, juveniles. And Director Abed was there. He wouldn't talk to us then. He said they would address it this afternoon. One of the issues that came up was that the agency promised to provide more bed space for girls last December, but didn't do it. And yet they suggested had the money because the agency apparently gave some of its money to other agencies later in the year.
Let me just say something about when you said housing, what you're talking about is for detained youth or committed youth or youth who have been ordered into the care of DYRS.
Shelter space.
Okay, so I want to make some distinctions. That's not housing, that's a placement, okay? And there it is a continuum of placements, and what we're talking about and what today's action will allow us to do is to more readily get they call it shelter beds. What it is basically a group home space for committed youth. And that's what I think the judge was referring to. I can't comment on last December or today. I don't know if the deputy mayor or the director want to say a little bit more about that.
Sure. I mean, so we could talk about numbers and otherwise. Certainly, if you look over time, the agency has expanded and taken away from bed space as necessary. We do that based upon population and also on being good stewards of the resources we have. These are private providers by and large, and so having beds space open that we just pay for with no youth isn't necessarily the most responsible choice. Over the past 6 months, right, like by and large, for most of those months, there has been no shelter waitlist for girls. In October, there was an uptick, as we're talking about, and what we're seeing with our young people, and particularly with girls in the system, which led to 4 young people being on the wait list. We've expanded capacity, and there are no girls on the wait list today. And so what we do is make sure that we expand up and down based upon the population we see. But what we will say is this, is that we ask courts to determine what is the right level of placement for young people. Because while we're going round and round about whether it's a group home or otherwise, what we know is these young people have committed offenses. And to keep them safe, all of us need to really ask ourselves at this moment, what is the right level of placement?
Other questions? Yeah, Mark.
Could we hear from the director on this? And specifically, Director, you testified today before the judge that you're on track to sign a contract by December 1st that would increase the number of shelter housing beds between 18 and 24 beds. You said that would be for boys and girls. Can you break that down? How many girl beds will this new contracting allow you to expand to? And why is it so difficult? By your own data, since 2019, you haven't expanded the number of female beds in shelter housing. So what's the hurdle there? Why is it so much harder to?
Well, what has been the population of a young female that have been committed to DYRS? Well, what I'm saying that the answer is tied, Mark, and I'm not trying to be adversarial here, but what you heard from the deputy mayor is the capacity is dependent on the flow of kids that are committed to DYRS. And I don't know off the top of my head, but since 2019, that number has gone up and down, mostly down.
Well, I beg to differ that it has actually in recent months gone up. And
no, I didn't. I wasn't talking about the recent months. You mentioned 2019. Okay. It's 2023.
But since the judge's order in December, could we hear from the director and just?
No, I need. You can hear if I understand your question.
My question is, why is it so hard to increase the number of beds for girls?
Okay, that's the wrong question.
No,
the right question is, I'm not going to say it's hard. I won't concede that it's hard. It does take time, and we have to have the right providers. But we don't increase capacity when there's not the demand, for lack of a better word.
There is demand.
Now it is, and that's just what the deputy mayor said.
That's right. And so while the director has been able to increase in the past couple of months the capacity for boys, he's been unable to increase the capacity of girls. And by your own admission in this mayor's order, you're going to increase incentives.
We are going to increase, and
Increase incentives, I'm sorry to interrupt you, but to increase incentives for shelter housing for girls.
we
So
are. We recognize, I'm not arguing with you or anybody else in saying that we would like to have more capacity for girls. That's what we started out saying.
Okay, so
I told
why
the
is it-
council that last week that we would like to have more capacity in the continuum. We also want more detained space, secure space. And so the reason I started off talking about this so-called shelter home is that it is a group home space in community that's not secure. So that's the question that you're asking me about. But what I also want to be perfectly clear about to the community is that we believe that more kids, as you've heard me say many times, if they've been, arrested for robbery after robbery, shouldn't be in a group home, in my opinion. They should be in a secure, detained space. And so we have to do both. We need more detained space, which this emergency will also allow us to kind of speed up that construction process because of the procurement steps that we'll be able to take now. And we need more space in the non-secure space, which is the shelter home space. Director Abbott, did you want to add?
I think the mayor hit it right on the head. We have not had an issue of girls' shelter capacity until October. And once that issue was raised, now we are working to increase capacity.
Well, can you tell us of the 18 to 24 beds that you expect to bring online in December, how many of those would be for girls?
We are working with providers right now, and so we want to keep flexibility. I don't want to prejudge what we're going to do. We have to work with different agencies, Court Social Services, and DYRS work together on developing this capacity, but we are going to have additional girls' capacity. As you know, today we have no girls on the wait list. And before October, we didn't have girls on wait lists. So we're going to have additional capacity. It'll give us more flexibility, and that's how we're going to move forward.
So why do you have to increase the incentives to house girls? Specifically in the mayor's order, it says that you will create incentives to the providers to provide housing for girls. So it seems like it is harder for you to get these private providers to build shelter housing for girls. Why is that?
There is less need for girls' space. Private providers are for-profit entities, and so we want to be able to provide incentives so that we can get them on, because as those numbers show, we haven't had the need for two shelter homes for girls.
And then, Director, can I ask, how many times do one of these shelter housing providers decline placement? You have indicated in your staff's answers to Channel 4's questions last week that part of the issue with not having places for girls or some of the youth is that sometimes the providers would just simply decline placement. Why is that allowed, first of all, for them to decline somebody, and how often does that happen?
Shelters can decline somebody and generally don't do it very often, but when they do, it's because they've had experience with that young person. And we've had cases where young people were in shelter beds and did tremendous damage while they were there. And if you've moved from one to another shelter and damaged all the shelters and no one will take you, that's why they would decline.
And then can you tell me about staffing levels at YSC? How often do you dip below one staff per 8 residents?
I don't have that information about how often we dip below. We maintain the staffing ratio at all times. So you're talking about the 1 to 8 staffing ratio? We always maintain the 1 to 8.
Even when you go above 88?
Yes.
And why do you need to add space? The deputy mayor talked to the public the other day, said you can double up there and go to 150 without any problem at all. Why do you need to add space to that facility?
We need to add space because we prefer to have kids in single rooms. And so having more rooms gives us more flexibility. There are a lot of considerations when we're looking at housing youth in detention. Number of kids is one of those but we are also looking at whether they have conflicts with each other and how we have to move them around. And so having additional space can give us the opportunity to move them into different units because we only operate one detention center. So the only way to allocate or keep kids separated that need to be separated and house them in conditions that they're similar in terms of age and capacities. Having additional space gives us more flexibility to do that.
Yes, next question.
Director, a question for the director. I know you were just confirmed folks are looking forward to the changes that you can bring to the agency, but I'm certain you're aware of the issues and the safety concerns that not only lawyers, but Councilmember Trayon White had when he visited with some of the melees that have occurred recently. Are children safe? I know we're talking about increasing capacity, but if there are staffing shortages, and Councilmember White told us there were some staffing shortages that led to some issues with the children there, how can we ensure if we increase capacity that these kids are going to be safe?
We can ensure that youth are safe, and having more space gives us that ability to ensure that they are safe. As I mentioned, we need to be able to classify kids and move them into different spaces based on a number of criteria that we look at. And so we're going to be looking at, do they have conflicts? Do they have size considerations? We look at their age, we look at their gender. So we need to have more flexibility in order to house kids and more effectively.
And you have the staffing to make that possible?
Yes, we do.
In regards, just one more question if you don't mind, in regards to the shelters, the housing shelters that you, how many do you currently have? How many more do we need?
I believe we have 4 shelters that we're contracting for. And it's not so much about the number of shelters as about the number of beds that we need. And as I mentioned, for girls, we do have enough beds, but having a second shelter is going to be helpful. Again, if we have issues with a young person that is not working out well with that staff, having another alternative is going to be an advantage so that we can maintain that youth at that level.
Okay. Yes.
So just one for the mayor. About,
Yeah.
I'm sorry, it's an off-topic question, but about the incident that happened last night with the U.S. Secret Service agents and the detail to provide protection for the president's granddaughter. Do you have any update on that?
I don't. I would go to Secret Service if
But
you
they're
have any
also-
questions.
They're also pushing us to you. I mean, have these people been apprehended?
I can't provide any update on that. Yeah. Darcy.
Yes, just off topic about
Yep.
March for Israel.
Yes.
Tomorrow, are you going to be asking for assistance, National Guard, anything like that, or any concerns about safety, any threats, and any counter demonstrations?
So I just got a complete briefing on that. MPD has asked for mutual assistance and support from the National Guard. The National Guard will be supporting some traffic safety points.
But no big counter demonstrations?
They continue, we continue to monitor. We expect a large gathering. We are paying attention to the numbers of buses that are coming that are, I think we can expect in the tens of thousands of people. So people who are coming, getting some familiarity with how to get around is going to be important. The organizers are setting up ways that people can be badged to enter. There is going to, I understand they're calling it a march, but it's actually a rally. It's going to be static on the National Mall. Yes, Stephanie.
Mayor, a question on a viral video that's been going around all weekend. We were hoping to ask you about this earlier, but it's a video that claims to be showing alleged DC teens basically debating what crime is worse to commit, an armed carjacking or a murder. This is based on the consequences for those crimes. Have you gotten a chance to see that video?
I won't be wasting my time watching that.
Why is that a waste of your time?
It's a waste of time because it is, if it is an accurate video, I'm not sure what I would do with that information.
My question follow-up to that is if you have kids at that level, since you won't watch it, and I'm describing that they're allegedly arguing.
No, I've heard descriptions of it, yes.
Is it possible to save those children? And what is it, do you think, at this point that's really gotten them to that level?
Again, I don't want to, given as much fake information that's out there in social media, I don't know that I would spend a lot of time talking about it or glorifying it. So I won't.
Then a follow-up then to the
Yep.
director and questions about shelter space and what
Sure.
has been provided for. The emergency legislation that went through the district over the summer also changed the presumption, right? Holding more juveniles before trial. So was there additional space added then, knowing that you're now potentially pushing more juveniles into the system?
We already talked to you about the capacity issues.
So there was, just to be clear, at that point when that emergency legislation went through, that no extra space was added.
We didn't add any, say again?
We're asking for detention.
Yes, that emergency presumes secure detention.
Okay. I want to also talk about, I want to ask you, do you agree that the city has to do all it needs to do to address juvenile crime?
Are you serious?
Yes.
Yes.
Because then the question follow-up to that is, why then has your office decided to close a DYRS oversight office that has been funded for the fiscal year?
My office hasn't decided that.
That is the case. It's an oversight office for juveniles.
I'm aware of what it is.
Can you then please clarify what exactly is happening if you're not closing that office?
What I said is, I haven't said that I'm closing anything. We do have an office that has a certain lifespan that I created it so I can extend it or not extend it.
But if you want everyone to do everything they should to be getting kids the services they need, shouldn't that stay open?
They don't provide services.
No, but they have oversight over the agency that is providing services.
They don't really have oversight over the agency. The agency that has oversight over DYRS is the Council of the District of Columbia.
So you're absolutely saying to the community that if that closes, it's not an issue, it's not going to impact juvenile crime in the district?
I haven't said one thing or the other about that office, but what I'm saying is, you asked me if it impacts services for DC young people at DYRS, and I would say it doesn't provide services.
No, just to be clear, I said it impacts the agency that provides services.
No, that's not what you said. You said whether it is going to impact services to DYRS.
Okay, and then afterward I corrected myself and I said no, that it provides oversight to the agency for children in the U.S.
Okay, so let me just step back a little bit. And I created that office as a bridge from when this agency was transitioned into independent operations. We've supported it throughout, and we will assess the need for it to continue. I do think that you put your finger on one issue, and that is if we're talking about kids getting more services, and we have a lot of services, but we're always assessing how our services can better interact with families and interact with young people to engage them and make sure they're taking advantage of the services. So part of our consideration is what is the next needed investment to do exactly that.
And then another, if I may, any reaction to the fact that two businesses, a restaurant and a bakery, and a very big hotel in the downtown area recently announced that they are closing, and at least the two businesses, the restaurant and the bakery, are citing DC crime and high costs as reasons?
I think a lot of our retailers, you've heard me say, have had a tough time post-COVID. Some of that related to operational differences, some of it related to labor cost differences, some of it related to fewer people who are frequenting their businesses. And I have no doubt that some of it is related if they've been a victim of crime. So all of those things are impacting retailers. You've heard me say that. Yes.
Last question. I just want to know if you can confirm or not that the DC police is investigating what happened with the security detail of President Biden's granddaughter?
I don't know. I have not been fully briefed on that, so I don't want to say. I think typically, though, it's our policy that if there is an officer-involved shooting involving one of the other police agencies, MPD is the lead agency in the investigation.
So could we reach out to your office later on to see if there's
You can reach out to MPD. Who hasn't asked? Yes.
To follow up on Stephanie's questions, last we heard from the Deputy Mayor's office, the DYRS Oversight Office was set to close on January 6th of 2024. You mentioned you were maybe reassessing that. Is that the current plan, that Mark Jordan's office would wind down then?
Mark Jordan doesn't have an office. We have an office that we created that is an independent oversight office, and it shouldn't be associated with a single person. But what was your question? Is
January 6th the plan to?
I already answered that question.
Sorry, I heard you say you were reassessing. So I guess.
Well, I don't know if that was my word, but I'm assessing.
Okay, so I guess I'm just curious, what went into that decision making? Why did you decide now was the time that the office should wind down?
I didn't decide that, but we have we have an agreed upon time. Am I misremembering this?
The mayor's order. So the mayor's order that established the office as part of the settlement says the office shall sunset operations 3 years after basically it begins operations. So that there was already built in to the mayor's order a sunset. It was not open-ended. It was very explicit. And so there's no decision point other than if the mayor chooses, as she said, that via a subsequent order or otherwise may continue the office. But that office will sunset per the mayor's order that established it 3 years from the date that it began operations.
Yeah, I appreciate that. I'm just seeking to understand. We've
There's
discussed.
No decision.
Well, I'm just seeking to understand. We've discussed problems with DYRS. A lot of people are telling me they see a need for that office to keep providing data, to provide visibility on what's going on in YSC. So why not have another set of eyes on it?
Well, there is a lot of probably 800,000 reasons why not. And the question of what is the best investment for DYRS. I've heard from recently, like last week, members of the council who started to talk about that office. So that's why, I'm going to regroup with the team and talk about it. The other thing that we should consider is making sure if it did continue, for example, is it focused on the right things? Are staff showing up? Do they go to the office, for example? Are they in the facility? Do they impact services? I mean, I think there's a lot of things that if I have an opportunity, which I would, if we want to continue in this regard, that we are kind of looking at the agreement. Yes.
I was hoping you could talk a little bit about the decision behind launching the public emergency. There's been a lot of talk about crime over the past couple of months. And I'm also curious how you see this public emergency affecting crime locally more recently, such as carjackings, car thefts, etc.
Well, I see this as most emergencies are, as an administrative tool. And I've talked about this recently. And how can it expedite us doing some of the things that we're already doing? And largely, it will help us in a contracting aspect. It could impact how we deploy personnel, but mostly it's a contracting vehicle.
And I was wondering if you could talk a little bit about a memo that's been circulating around town where DC Police has been urging people to drive carefully in the city, such as what people would do for embassy personnel in a dangerous city. It's been going around Twitter and social media a lot. And there's also been other advisories around crime from other countries as well. Embassies directing their local personnel in the city. I'm just curious from you, do you think this public emergency will help drive down the crime in the city? As well as, what do you tell the visitors who are coming to town tomorrow for this massive rally? When some people are concerned about safety.
They're not, actually. They're coming to exercise their First Amendment rights. And I would give them the same advice that I always give them. Know how to use the metro. Don't leave valuables in your car. Let somebody know in your group what to do if you get separated from each other. Not just spend time in federal Washington, but get to know our neighborhoods as well. That's what I would tell them. Yes.
Mayor Bowser, when it comes to the opioid emergency order, FEMS already tracks non-fatal overdoses. Are there agencies that haven't gotten that data that need it? And will that common tracking system be a public dashboard?
Yes.
So I'm actually going to turn to two of our directors in a moment, but just to clarify, the purposes of the data that's alluded to in the mayor's order would just be an internal metric that we would make sure that agencies are able to cross-share. But I'll ask Dr. Holman and Dr. Bowser to expand a little bit more on the mechanics.
Good afternoon. Currently, the Department of Behavioral Health, FEMS, and the Office of the Chief Medical Examiner all collect data. One of the purposes of this is so that we all have our own individual portals. And so the purpose is for us to be able to have a single repository that will allow us to have data, just-in-time data from FEMS and DBH in particular, so that we can appropriately and more efficiently deploy our outreach teams to areas where there are hotspots. Now,
I'm Dr. Holman from Fire and Emergency Medical Services. We already share our data with Department of Health and the Department of Behavioral Health. We keep track on our data very, very closely, but this shared common data portal will allow us to communicate among agencies, I think, more effectively.
Okay, I'll take a few more.
I'm curious when it will be ready, and Mayor Bowser, I'm curious also if there's anything that convinced you that this would be a substantive order as opposed to symbolic or something in only that you had alluded to.
Well, we spent some time thinking about that, and we believe that the contracting vehicle will allow us to move, we hope, more quickly. Honestly, it is the faster that some of the commission and others are able to prioritize the investments that will make this order more impactful. Yes.
Hey, Mayor Tom Rasley, 7 News.
Hi, Tom.
Wanted to ask about the more the city seems to focus on crime and violence, it doesn't seem to be having an impact at this point. You have 5 homicides in 36 hours. What more can be done to try to get these numbers down?
We are just going to keep pushing on all fronts, and we know that as the ecosystem itself corrects, there are more accountability measures, that prevention efforts take hold. It will drive down numbers. We will get there.
Can you explain ecosystem? Is that courts? What is that?
That's everything. That's everything that impacts our criminal justice system, from the laws, from courts, from supervision to agency administration of all the public safety agencies, from workforce programs to schools, everything that impacts criminal justice.
Are you convinced eventually we will see the numbers go?
Absolutely. Yes.
Thank you. I'm Jenny Radford from WAMU. I have one question about each emergency. I'm not sure if the question got answered already. I didn't hear the answer. Will the data be public, the fatal, non-fatal overdose on like public dashboard, like COVID data, or will it be just internal?
We're expecting it to be an internal dashboard, if you will.
And I also have a question about DYRS. Last month, there were 36 injuries to youth, 32 youth and youth assaults at YSC. Those numbers are higher than they've been in a long time. What's happening to sort of address that problem and keep kids safe in that facility?
So one of the things that we haven't talked about is there are a lot of different populations at DYRS. And so one of the things that you heard from Councilmember White or otherwise is about incidents. And some of those incidents, we currently have 2 units of Title 16 youth, and those are our youth charged as adults. Over time, those youth are there for a very long time, right? Because they're in a pretrial state waiting for trials, and we know that our courts need more judges, right, to prioritize those cases. The reality is in incidents or in facilities over time, young people get frustrated, various things happen. So some of the incidents that you're hearing about are happening on those units, and I point that out because, right, like those young people are there. They're not a population we can move, and they're occupying 2 units. DYRS does what it will always do. Sometimes, depending on the population of young people there may be young people who have beefs with each other or otherwise. So as we increase capacity and our ability to move young people around, we have every confidence that just as we always have over the past decade that I've been involved with DYRS, we'll drive those numbers down as well. But I point that out because some of the larger incidents that you're hearing about are those populations that what we would ask is that the courts really prioritize. Let's move those cases along for those young people because the uncertainty can drive some of the behaviors that we don't want.
Just a quick follow-up. Sure. Right now, how many units are staffed with 1 YDR? How many have 2? Are there 2 on every unit every day?
So we always maintain the 1 to 8 staffing ratio, and how there are daily deployment schedules. Generally, we don't want to have a unit with just 1 staff member, but certainly we're going to always work to maintain that DOJ, right, like youth to staff ratio. And so every day is going to be different based upon movement, population, call outs, all of those different things. But certainly maintaining at least that 1 to 8 ratio is absolutely what we work to do. And then, like I said, usually we'll have a deployment schedule that indicates we always want more than 1 staff on a unit where possible.
Okay, last question here.
Mike, how you doing? Mike from WTOP. 2 on the opioid overdose situation. And the first one, when it comes to recovery programs, I've done some stories on this where you talk about it's not only hard enough for adults to try to get into those programs, but especially for youth. We're talking about the youth side of this. Does this include anything? I know it says there are some programs, but I'm talking about those, you put someone in a program, you help them recover. Does this include provisions for that, making that more accessible?
Yes, it does. One of the things that we are doing is expanding our ability to provide youth-specific services for those youth who do have an opioid or a substance use problem. We really do want to get people early. So the other piece of this is through our school-based behavioral health program, we also are providing education, prevention education, so that young people can make healthy decisions, and so they won't go in that direction.
But for those sort of inpatient type programs, are those going to be, there going to be more available places for that, the incentives being offered here?
Yes, currently we do have some limited inpatient opportunity available for young people. In addition to that, both Children's Hospital in partnership with Howard University have established a clinic that provides medication-assisted treatment for young people and provides ongoing care. And one of the important things to point out, it is not just taking the medication. It's also important for the individual to get the counseling support they need so that they can not only move into recovery, but sustain recovery over time.
And finally, the last follow-up on that with the dashboard on the overdoses not being made public. Other states do have that information public. Why has the decision been made in D.C. to not allow the public to see what numbers are coming up across the city?
Well, there is publicly available data on the DBH dashboard, so you may want to go there and look at Live Long DC, and you will see that information. What we're talking about is getting information quickly in real time for greater coordination, and that data will wind up on that dashboard after. Okay.
All right.
Just 2 quick questions. On the opioid, the council had requested a public health emergency be declared, and this is just a public emergency. Can you tell us why you decided not to go the extra step of a public health emergency?
The public health emergency, Mark, involves a lot of issues that we don't think are warranted in this case, including a lot of what we saw around consumer payments and debt and all of that is not implicated here.
And then on the juvenile violence component, it calls for developing a plan to monitor GPS in real time. Can you tell us how would that work, and when would that actually get implemented to a point where, for instance, the person who responded this morning in court had not been charging her GPS, even while she sat in court. It was not charged.
Who wants to talk about this?
And so, yeah,
Okay.
how would that work, and when would that start? Thank you.
So with GPS monitoring, we do monitor in real time, but I think the key part here in the order is about the rapid response. When we find something that's not being done, like that GPS device not being charged, we want to be able to send somebody out there to respond to that and determine, was this just a mistake, or is this somebody that's trying to evade our GPS monitoring, and then we can respond accordingly. We want a fast response.
So right now you are monitoring. What's this? How does it look right now? So you are monitoring. If somebody's looking at a dashboard with all the GPS and can see.
So yeah, we get alerts, but the order also contemplates working with our partners at Court Social Services. So there are two monitoring systems, and we want to work with them to merge them together so that we monitor together and respond efficiently to those issues.
Thank you.
Thank you. All right, thank you.